Hypertrophic cardiomyopathy is characterized by a thickened, non-dilated left ventricle that causes left ventricular outflow tract obstruction and often causes reduced exercise capacity. Left ventricular outflow tract obstruction is an important target for therapy. A new trial evaluated the efficacy and safety of Aficamten, an oral selective cardiac myosin inhibitor that reduces left ventricular contractility in adult patients with symptomatic obstructive hypertrophic cardiomyopathy. In this Phase 3 international double-blind randomized trial, 282 patients with a confirmed clinical diagnosis of hypertrophic cardiomyopathy, defined as a left ventricular wall thickness of 15 millimeters or greater in the absence of pressure overload or other discernible causes, and a left ventricular outflow tract gradient of 30 millimeters of mercury or more at rest, and 50 millimeters of mercury or more after the Valsalva maneuver, were assigned to receive oral Aficamten or placebo once daily for 24 weeks, in addition to standard drug treatment. The primary endpoint was the change from baseline to week 24 in the peak oxygen uptake, as assessed by cardiopulmonary exercise testing. Overall, the mean change in the peak oxygen uptake was greater among patients in the Aficamten group at 1.8 milliliters per kilogram per minute than in the placebo group at 0.0 milliliters per kilogram per minute. All 10 pre-specified secondary endpoints also favored Aficamten. These included the change from baseline to week 24 in the Kansas City Cardiomyopathy Questionnaire Clinical Summary Score, an improvement from baseline of at least one New York Heart Association functional class at week 24, and the change from baseline to week 24 in the left ventricular outflow tract gradient after the Valsalva maneuver. The frequency of adverse events was similar in the two groups. The authors conclude that in patients with symptomatic obstructive hypertrophic cardiomyopathy, treatment with Aficamten resulted in a significantly greater improvement in peak oxygen uptake over a 24-week treatment period than placebo. Full trial results are available at NEJM.org.